development of colorectal carcinoma, of cancer of the intestine. And cancer of the intestine is a major killer among both men and women above the age of 50. And you all know about it, that there is a recommendation of the American Cancer Society and of many other cancer society for both men and women to go and do intestinal examination, let it be one way or another, we'll not go into it, every 5 years, because this is a preventable disease. If you catch it when it's young as a polyp, and the polyp is being taken away, you can simply rescue your life. If the disease will progress, and it's very hard to follow the disease because the cancer of the intestine develops in a big cavity, so we don't feel the tumor. We can diagnose it only when it's very big. It may be too late. At that time, it sends metastasis, it sends messengers to the liver, to the bones, and then it's impossible to rescue the patient anymore. So inflammation leads to cancer. And inflammation by itself is very bad, not only when it leads to cancer. So for example, heart attacks, another major killer in the Western world, is also caused by chronic inflammation where cholesterol is accumulating in the arteries of our heart, and in the margins where the cholesterol is progressing, we are seeing inflammation. So if we are preventing inflammation, we can prevent, we are not treating, we can prevent heart attacks, we can prevent colon cancer. You see, there was a woman here, you see, this woman holds her breast. It's clear that aspirin can prevent breast cancer, and it's clear that aspirin can prevent heart attack. You see here the heart, these are the two supplies. We'll get to heart attack a little bit later, so I'll explain you why. And aspirin is extremely powerful preventive drug. Also, aspirin is now, I'm taking aspirin, luckily I didn't have anything, but people that had heart attack are forced by their doctor to take aspirin because aspirin prevents blood coagulation. Aspirin doesn't allow the blood to coagulate in the coronary arteries, and it prevents additional heart attack. So people that had heart attack will take aspirin forcefully by the doctor. Now, like any other drug, aspirin has side effects. The stomach is very sensitive to aspirin, and if we take aspirin, we may bleed from the stomach, and therefore it is not recommended en masse. It's kind of a double-edged sword. So people, we shall not add aspirin to our bread like we are adding fluorine to the water. So if people want to take it, obviously they do it on their own risk, but once they had a heart attack, the risk of getting a second heart attack is much bigger than the risk of bleeding once you are taking aspirin to prevent the second heart attack. So aspirin became a blockbuster. Bayer probably laments the fact that they don't have the patent anymore. Everybody can sell it. You can buy a ton of aspirin for $5. You can buy a year's supply in any pharmacy for $5. It's not patented anymore. So aspirin really became, I think, the most sold drug in the history of pharmacology. I don't think that there is any drug that has been sold more than aspirin in modern history. Now think about Mr. Hoffman. Why do I tell you all the story? I'm not here to teach you medicine. Just because this guy, on his own, became the physician of his father. This is completely incidental. I mean, if he wouldn't have been there, I believe that aspirin would have discovered, but it would have been discovered much later. So remember where we are. We are talking about drug discovery. We are talking about the first revolution. And the first revolution basically was not a revolution. It was incidental discovery of people that were motivated by different motives. This is why this guy, Mr. Hoffman, was a chemist. And all what he had a sick father. And then he remembered the history, the old Egyptian and French history, and then he decided to pull it out of the drawer and to go and try it on his father, showing the results to his bosses in Bayer, and then Bayer went into it. Let me just give you one more example of what I call incidental discovery. And you will see how intelligent people really saved the world. Sir Alexander Fleming. the one who won the Nobel Prize for discovering penicillin. How did he do it? He had a very sharp pair of eyes. The whole secret is sitting here in this dish. Now, what is this dish? You don't know what is this, and I'll tell you in a minute. This is a Petri dish on which scientists grow bacteria. So we take a plastic dish. It's a sterile plastic dish. We overlay it with a nutrient material. We call it agar. So this is a very rich food solution that the bacteria are using. And then we are putting bacteria on it, and the bacteria are growing. You can see here, obviously you don't see one bacteria. For that you need to have a microscope. But if you look at it, you see that the bacteria are smeared here around. So they like it. It's a very good source of food. So he took this dish. If we want to stop the bacteria, and obviously we cover it. We cover it because we don't want other bacteria to come. We want only our bacteria to grow, but we don't want the bacteria that are in the air to come down and contaminate it. So it's a dish, and we cover it with a plastic cover. And then if we want to stop the growth of the bacteria, we take the dish and we put it in the refrigerator, because bacteria will not grow in the refrigerator. They will grow only either at room temperature or preferably in an incubator where the temperature is like our body temperature, like 37 degrees. Sir Alexander Fleming got the Nobel Prize for making a mistake. He made actually two mistakes. One mistake was that he didn't cover the dish. He forgot to cover it. The other mistake was that he didn't put it in the refrigerator. Basically, he left it on the table. And then he came the next day, and he saw something very strange. He saw that on the dish there was a white spot here. And the white spot, he identified it immediately, was not bacteria, but was a fungus called penicillium. But then he knew that it's a fungus. But then he noted that around the fungus, there was no bacteria. You see here, there is a halo here. Bacteria is only this white smear. But here, around the fungus, there was nothing. So he said, what's going on here? Aha. The fungus secretes an antibiotic. What is antibiotic? It's antibios. Bios is life, biology. So the fungus secretes a material that is anti the bacterial, and it doesn't let the bacteria to grow. And then he said, now I'll go after this material, and he isolated penicillin. All what he took is two mistakes. Not covering it, so it allowed the fungus to fall from the air, and not putting it in the refrigerator, so it allowed the bacteria here to continue to grow, and also the fungus to grow. And then he came in the morning and saw this halo, where no bacteria could grow. And the world changed its face ever since. You have to understand the importance of the development of antibiotics. It really changed our life. If we are thinking about the 19th century and the beginning of the 20th century, people were living about 40 years or 50 years, not more. They died mostly of infections. Women died in the delivery room from a simple tearing up of the delivery canal. Men died of any wound. Soldiers in the battlefield, simple wound. I'm not talking about gunshot wound. They died because of infection. We couldn't operate. You know, the surgery was so primitive, because how can you open an abdomen of a patient or make any operation if you are exposed to bacteria? The whole sanitation and sterility, hygiene techniques were not there because there was no antibiotics. We couldn't protect ourselves at all. Once the antibiotics came, it changed completely our understanding, and penicillin was the first. And then came Waxman and the tetracycline, and then more sophisticated antibiotics and more sophisticated antibiotics. And now we are treating, think about rheumatic fever, think about simple laryngitis, think about abscesses, think about all the infections, about tuberculosis, about all these infections that we basically, unfortunately not completely, defeated. And the bacteria are coming back now, and they are more sophisticated, and they are mutated, and pharma companies don't want to develop more antibiotics because it's too expensive and it's only short-lived, because the bacteria develop resistance. But I will not go into all that. But basically, we can thank the antibiotics and Sir Alexander Fleming for this discovery because it doubled, almost